I've served on the Budget Committee now, well, for the 7.5 years that I've been in Congress. And to a man, every expert that has come before our committee, whether they're Republican or Democrat, whether they're from liberal organization or conservatives, every one of them said the same thing, that the entitlements was one of the largest issues and financial problems that this country is going to address and needs to address in Congress. But as we've seen over this past administration, nothing has been done to solve that problem. Just the opposite, actually, rolling back some of the initiatives that were passed in past Congresses to try to address it. So what has been done has been bad as far as trying to address the entitlements dilemma that all experts agreed needs to be addressed. And what needs to be done now is some of the recommendations that the experts have presented to us in the Budget Committee. And matter of fact, some of the legislation that had already passed under Republican leadership to try to rein these programs in and to set them on a sustainable platform so that we know that this generation, our kids' generations, and our grandkids' generations will have these programs or similar programs in place in the future, and that they will not be lost as we know them today.
What kind of changes do you mean?
Well, in the past, Congress began the process with regard to the entitlements to try to slow down what we call the growth curve. That means to say not to eliminate the programs, but just to rein them in over the life expectancies of the programs. And as you know, these programs look out towards some words, I guess, 70-year life expectancy. And so we had begun 4 or 5 years ago to say we could rein in this area to the tune, I think it was, of $30 to $40 billion. Not a cut, but just a slowing of the growth. And that's really what we need to do.
Is that the doctors' reimbursements?
Doctors' reimbursements really don't play into it. That's one of the things that often comes up and always is cut off day one, and by the administration, whoever it is, Republican or Democrats, and Congress always puts it back in. And it has to be, because we know from talking to doctors that if you put those cuts and keep those cuts in place, well, the doctors will simply say, we're not going to take any more Medicare or Medicaid. That's not the type of solutions we're talking about. The solutions are some of the things that we've implemented in the past and tried to put in the past, and some of the experts say need to do in the future. Reduce the growth curve so that you're not, I can't do it without a chart here, so you're not increasing at this rate, but lower the rate of growth in healthcare costs. And that actually goes back to healthcare reform as well.